Hi.
Hi.
Hello, can you see us yet?
No, I can't.
Hold on, let me turn the camera around.
Hi.
There we go. Hello. Well,
Quick
I
pushing
think
the
you.
button.
that's better.
Hi, how are you?
Doing well, how are you?
I'm good, thank you. Today's been a long day, so.
Tell us about it.
So, do you want to just get right into the question? So basically, I have a list of questions that I usually ask parents, and you're feel free to answer any question you feel comfortable answering. If you don't feel comfortable answering a question, just let me know, and that's completely fine with me. And then at the end, if we do have a few other people who are on, I don't know if they will be, and they want to ask a few questions, I think you can do a question thingy where they just ask a few questions, and you guys just can answer however you want. So,
Sure.
all right. So you want to just get started?
Why not? Let's go for it.
All right, so the first few questions are basically could you tell me a little bit about your child, name, age, what rare disorder they have?
Sure. Her name is Anna Violet Day. She's 5 months old, and she has PBD/ZSD, which is Peroxisomal Biogenesis disorder, Zellweger syndrome disorder.
Oh, okay. So, what is this disorder do to your child?
Well, peroxisomal disorders they're a rare genetic autosomal recessive disorder. It's generally terminal in childhood. There's no cure for the disorder, and the treatments for it are symptomatic. Different types of symptoms are like hearing loss, vision impairment, global development delays, neurological issues, adrenal insufficiency, feeding difficulties, liver and kidney issues. It can affect any and every aspect of the body, really.
Oh, wow. I'm sorry to hear that. How did you react when you first found out your child had this disorder?
Wow, that was when we first found out she was...
Lots of tears.
Yeah, quite.
Lots of tears.
We were still in the NICU when we found out. And it was, for me, it was more shock than anything. It was kind of hard to fathom that, our daughter had been given this diagnosis that there is no treatment for, really, and there is no cure. And I know it kind of hit us like a brick wall.
Yeah, no, that makes complete sense. A lot of families I have interviewed said the same exact things. They were shocked and they didn't know how to because it's so rare, rare disorders. You don't hear other people who have it. It's not like Down syndrome or cancer where you see you actually know people who have it, and a lot of the times doctors don't know what to do, and a lot of times people go undiagnosed because it's so rare. So there's actually someone who is 32 years old and literally just found they were just diagnosed despite having years of
right.
So
yeah, we were actually quite lucky as far as the diagnosis goes. That's Anna now, by the way. We live in Tennessee, and they take part in newborn screenings, which does screen for certain chromosomal issues, not Zellweger specifically, but it picked up the fact that there was an abnormal chromosomal issue, and then after further DNA testing, we were able to narrow it down to find out exactly what she had.
How long did that take? How long how long did it take?
I would say it was, the first test took about 2 weeks. And then when the abnormal results came back, they retested to make sure. And it came back as abnormal again. And they told our doctor exactly which genes had the abnormality.
Yeah.
So they took her DNA and it was sent to Baylor University in Texas for further screening to give us an official diagnosis.
So, did your doctors, oh, sorry.
No, go right ahead.
Have your doctors, ever, the doctors who diagnosed your child, have they, ever heard of it before? Or was this, the first time? No?
No, they did what almost every doctor does. They Google it at first.
Oh.
Right, insert eye roll here. Because the sad part about that is 90% of everything on Google is either outdated or wrong
Yeah.
about Zellwegers. So we were lucky in the fact that the hospital that she was born at, they were more than willing to fess up to the fact that they weren't familiar with it.
Mm-hmm.
But luckily we're in Nashville, so we're close to Vanderbilt University.
Yeah.
Where there was actually a physician who was familiar with it.
That's good. That's good to hear.
Yeah, it really was. They've pretty much built an entire team at Vanderbilt for her,
Mm-hmm.
even bringing in doctors from Canada.
Wow, that's incredible.
Right.
A lot of
So,
times,
I mean, we're truly blessed to be where we're at.
That's amazing. A lot of families, you know, they don't have like. There's one of the first families I interviewed. Actually, they had to drive 3 hours just to find like a doctor that kind of knows what they're doing. It's amazing to know that they have a whole team just for your child. Like, you don't hear that often.
One of the things that really helped us, there is a foundation, the Global Foundation for Peroxisomal Disorders. It's one of the kind of an organization that really helps bring scientists and researchers and doctors together with the families. They help fund research. They work with Harvard University, McGill University in Montreal, Baylor in Texas that did our testing. They have a scientific board made up of pediatricians, chromosomal researchers from Switzerland, from China. I mean, literally all over the world.
That's amazing.
And they've really brought us to Washington D.C. For their biannual family and scientific conference, where we were actually able to get Anna examined by that scientific board. So
that's amazing. She's blessed to have like doctors, and you're blessed to be living near like the universities that have like these research groups. You don't hear a lot about that, and that's amazing for you guys.
True. I mean, it was. I mean, we're just so blessed to have that at our fingertips like that.
That's really good to hear. So could you tell me a little bit like about your daily life, like what you have to do with her every day? Like, does she have to go to therapy? Does she have to go to physician or a doctor like weekly?
Daily life with Anna is very complex. She is fed by G-tube because she does have the feeding issues that most Zellweger patients have. So feeding with her is every 3 hours and continuous feed all night long. Part of the issues with her peroxisomes is she's unable to break down long-chain fatty acids, so she has a very specific type of formula that she can use. It's made from a plant-based protein, so it's a little easier for her liver to process things like that.
Okay.
We have to check her temperature. We have to check her temperature every couple of hours because she does struggle maintaining her own temperature. She gets hot really quickly. She gets cold really quickly. It's literally, can be anything. A lot of the physical therapy, speech therapy, the normal stuff you do with a baby, the tummy time, you try to incorporate all of that. But one thing's for sure, caring for Anna is definitely a 24-hour job.
Yeah, that makes sense. So, has like one of you guys like quit your job? Because a lot of parents I've interviewed, like they had to completely like leave their jobs because taking care of their child was a 24-hour like thing.
Yes, Jennifer did actually have to resign her position. We actually both worked for the same company, my baby girl. But she did have to quit, and we're now down to one income earner. And I mean, it's a struggle.
That must be really hard. I mean, for her, she probably has a lot of needs, and then you guys have to pay for food and doctor's visits, and you guys have to pay for yourselves as well. So it's hard. But I mean, it's good that you have an income. There's a lot of families who, one recently I interviewed, her husband actually left her due to her child having this disorder. and she had to quit her job, and she goes from job to job. So it was hard, but it's good to hear that you guys have an income. Yeah, you guys are struggling, but trust me, I'm sure it'll get better. I mean, you have like a research team to help your child, so that's good.
We
I'm
do.
sure they'll find something to make this, like, might not always be a cure, but they'll probably find a way to make it better, make it easier for her, make it easier for you guys. So
That's the hope. I
mhm,
mean, in with organizations like the GFPD, you know,
mhm,
they are. I mean, we're in direct contact with, you know, the people who run that organization practically every day.
mhm.
They are, and they're really focused on the family. So
Yeah,
any type of
that's good. So,
assistance that
oh,
they can help us with, they definitely lead us in the right direction.
that's good to hear. How many families do they actually help? Like,
Well, right now there are, and of course these are just guesstimates of what's been diagnosed.
mhm,
But right now there are 509 families registered with the GFPD
mhm.
that is both living and deceased patients. Currently, right now that we know of, there are around 250 living PBD-ZSD patients around the world.
Wow, that's actually not a lot at all.
No, not
If
at all.
anything. So, sorry. So,
You're fine.
the next question, could you tell me like a little bit about Anna, like what she likes, what she dislikes? I mean,
Well, Anna loves to ride in cars as long as you're not stopped. She cannot stand to stop. But she has a little polar bear wubbanub
mhm,
that it's like a little stuffed bear with a little pacifier on the end of it
mhm.
that she absolutely adores. She loves. She's got 5 or 6 other ones, but all she wants is her bear. She loves to watch cartoons.
Mhm,
She is deaf,
mhm,
and we do have hearing aids for
mhm.
her. So luckily, she maybe later on in life she may be a candidate for a cochlear implant.
Oh,
So,
yeah, I've heard of
so
those.
depending upon how her growth goes from here until probably about 2 or 3 years of age, we can look at
Mhm.
that. But she's very small for her age. She's 5 months. She weighs, what is it?
Oh, 9 pounds, 11 ounces.
9
9 pounds.
pounds.
So she's
Wow.
just now reached like a newborn, you know.
Mhm.
When she was born, she weighed 4 pounds 6 ounces, something like that, you know.
Was she
So she's
born
very
deaf?
tiny. No, she was able to hear
Uh-huh.
when she was born, but lost her hearing relatively quickly.
Oh.
That's one of the things with the peroxisomal disorders.
Uh-huh.
They can literally be just fine, and you know, in her swing, and then the next minute they're crashing.
Yeah.
And we have to carry emergency cortisol shots.
Uh-huh.
We have to carry different types of emergency medications. We have to have paperwork copied in my car, her car, at work, at my work, at our parents' house,
Mhm.
anywhere she could possibly be in case something goes wrong. We can give that information to the EMTs on how to treat her.
Mhm.
She's not a real big fan of crowds at all.
Mhm. Yeah.
Kind of,
Yeah.
we think, and of course, we'll know more as she
She
grows.
grows, yeah.
But we think she may have some sensory issues.
Mhm.
But as of right now, cognitively speaking, she's right where she should be.
That's good.
She does have some liver issues and endocrine issues, things like
Mhm.
that. But we are part of a research study for a drug called Colbam.
What does that do? I've never heard of it.
It is the only it's cholic acid is what it is, and it's the
Mhm.
only FDA approved drug that will actually treat Zellweger's patients for liver issues and
Mhm.
the myelin in their brain. The myelin is kind of hit or miss, but it's
Yeah.
actually her liver enzymes drop dramatically. So that's been very helpful.
Uh-huh.
But other than that, she's just your normal, very tiny 5-month-old baby.
Um, so how does this disorder like affect your social life with friends, family?
Friends, it's they try to be helpful, and you get the that must be so hard. Let me know what we can do
Yeah.
for you.
You
And
hear
it's
that
just
all
like,
the
I don't
time.
know what you could do for me, you know. I'm just like, I don't know. We have very, very, very supportive families.
That's good to hear. That's
My
always good to hear.
parents and her parents, you could not ask for better, truly. When we do go out, you know, of course, it feels like packing for a weekend trip to go out to dinner because
Yeah.
we have to have, you know, she's fed through a G-tube, so we have to have her formula mixed and in the bag and in the pump and ready to rock. And, you know, make sure we have her emergency medications with us at all times. You know, her diaper bag is not your normal diaper bag. It's pretty huge, you know. So it's definitely placed a damper on a social life, per se. As long as we know we're doing everything we can for her, then most of the time people understand we can't make it to a lot of things.
That's good.
And I think we've frozen up. Can you hear me?
Oh, yeah, I can hear you. Can you
Oh, hold on one second. You there?
Yeah, can you hear me?
All right, there you are.
Yeah. Oh, I had a question in mind. Oh, yeah. So basically, that's good to hear that your family and your friends are extremely supportive. Family, especially. That's always good to have family who will always be there for you when you need it. Because yeah, that's extremely good to hear. So if you're, I had actually a question besides like this. When she grows older, do you think that you would want to put her in school, or do you think it's kind of going to be like a homeschool thing?
You know, it's funny. We were actually talking about that earlier this morning. It really kind of depends. You know, if we feel that the programs that the school systems here in Tennessee offer will be beneficial to her, and if she's able to tolerate social settings
Yeah, because you
where
said
mom
she
and
doesn't
dad may
really like
not be
crowds.
present.
Yeah.
Right. You know, I mean, if it's like very small groups, you know, 5, 6 students to a classroom, then if that possibility is there, we would like to take it just because we want to give her that experience. You know, we don't know how long we'll have her. And we want to make her life as meaningful as possible. So any of these experiences that we can give her, we want to. But if it's going to be something that's going to just put more stress on her, or a situation to where the school systems are not set up to deal with a student like her, considering what can and more than likely will at some point go wrong,
Yeah.
then if it's safer, then we'll definitely keep her at home.
Yeah. Because what I hear from like public schools nowadays, it's all like like kids who don't fit in, always are left out, bullied, and that's what I hate about the public school system is you have like groups, and if your child doesn't like fit in the group, they're always left out, not included, and bullied most of the time. So, I mean,
Exactly, and that's the farthest thing we want for
yeah.
her. You know?
No, that's understandable. No one wants that for their child.
Right.
But public schools are doing a good job, like gradually of being more inclusive for children with like rare disorders. Like from when I was in middle school, they had a whole like my school now they have like special classes for like the special needs kids. So they're working on becoming more inclusive, and they're working on like informing students, because I'm a huge advocate for implementing disease education, like learning about diseases, disorders in school, because I feel like if students like learn more about diseases and disorders, I feel like they'll be more inclined to like to be more inclusive, because they'll know like, oh, they're different from me and this is why, and like, you know. So.
Exactly. You know, I think the more that the students are made aware, the more they know about these different types of disorders that do make the, you know, like our kids different from them, you know, the more they know about it, the less scary it'll be.
Yeah.
You know, and, you know, then they'll be able to focus on what they have in common.
Yeah.
As opposed to what
like they can just ignore like the differences about them and just focus on them, like their personality. Like just
Right.
ignore the disorder and just focus on like, because a lot of like kids with disorders, they have an amazing personality. They're so humble, they're so sweet, like because they're growing up with such hardships. Like they know to be like humble through it all. Like they know like
We met when we were at the GFPD's Family and Scientific Conference in Washington, D.C. We met a family from Colombia, South America, and their daughter, I want to say she was around 13, 14 years old, and she had the same chromosomal issues that Anna has.
Yeah.
But with our Zellweger babies, even though the same gene can be mutated, the symptoms can be totally different.
Yeah.
But this little girl was so impressive to me. She spoke 3 languages fluently.
Wow.
You know, right, that's what I said. I'm like, I could barely speak.
How old was she?
She was like 13 years old,
13,
you know, and
wow.
I mean, she was so smart. She painted, she played keyboard, but all of her symptoms were pretty much at the waist down. She didn't have any muscle tone, so she was in a wheelchair. She had liver issues. She had, you know, the stuff that they normally have. But she just was so impressive to me. And it's just like, look what, if we focused on what she was so good at, you know, maybe she wouldn't feel so out of place when she's not with, you know, other Zellweger patients. You know, because I'll be perfectly honest with you, that's definitely a rarity. In our world, to have a child that aware and that cognitively, you know, I mean, truly, this girl was like leaps and bounds over me. I couldn't compete with her.
3 languages,
you know,
wow.
Right, you know, that alone just blew me away. But, you know, it was, you know, that's a rarity for us. But still, she was able to go to school for like half the day. But they weren't really prepared to be able to handle her needs. So she could only go like 3-4 hours a day. So everything else had to be homeschooled for her. You know, just on her physical limitations. They weren't prepared to deal with that.
Yeah, but that's amazing. A girl with like a rare disorder, like it just shows you that just because you have this disorder doesn't mean you can't. It doesn't stop you from doing anything.
Exactly.
And I feel like a lot of people need like that mindset, like that. So, and I know your child will probably grow up to be like extremely talented.
Truly hope so.
Yeah, I know it. Like, children with rare disorders and all that they're humble. They grow up knowing like all this. Like they grow up with these hardships. Like they just grow up to be humble. Like they know that there's other people like this, and I feel like they'll be the people that are more lenient to helping others.
Right.
Yeah. So, if your child could tell the world something, what do you think she'd like to tell everyone?
I think she would want people to know that she's here. She has this very, very, very rare disorder, and that just because the disorder itself, her specific disorder, is so rare, that doesn't mean it's not worth researching.
Yeah.
That doesn't mean it's not worth the time, money, and effort it takes to find a cure. Because a lot of these cures can be multifaceted.
Yeah.
You know, they can lead from one disorder to another, especially chromosomal. You know? So, and it was very important for me and Jennifer when we got her diagnosis that this was not going to be one of those situations where we were going to hide her away. You know, we want the world to know she was there, and I think she would want that too.
Yeah. Then what, like your Instagram, it could help like another family, like group, your research group, it could help another family. And like for everyone that has a rare disorder, I feel like you should take some kind of initiative because like what you are taking, like awareness you are taking, like could help another family. Like
exactly.
Right. So what you guys are doing is great. That brings me to the question. Could you tell me a little bit about the initiatives you have taken to gain awareness of your child's disorder?
Sure. One of, well, actually, the mission of like the GFPD, which we've become very active in, they're very focused on family research, but most of all hope. They focus on things like family-centered support groups, webinars with health professionals from all over the world.
Yeah.
The biennial family conference, of course. There's regional meetups.
Yeah.
Because when you have a child or you yourself suffer from a rare disease, there's no feeling in the world like actually meeting somebody that
Has
gets
the
it.
same like disorder. Yeah.
They understand. I don't have to take 30 minutes to try to explain something that is, like when it was first explained to us, we didn't get it either,
No.
So like, what? Wait, what? But they also give access to researchers and scientists and doctors that also get it and that are more than willing to reach out to your doctors.
Yeah.
And they will give them their personal emails. They will contact me with any questions. Here are the treatment guidelines that we've established over the past 9 years.
Yeah.
One of the things that we've done personally is on October 5th is Pause for PBD. It's kind of the anniversary of the GFPD.
All right, I'll keep that in mind.
Yeah, believe me, it'll be all over her Insta. Okay.
Okay.
But it's we are organizing a freeze mob for Pause for PBD here in Nashville, and we've also coupled with Your Pie Pizza, who has generously offered to donate 15% of sales that day to the GFPD so that we can continue to fund the research. And with one of the things that I really truly like and really love about the GFPD is that they not only include those of us that have living children, they also include the bereaved, because even though your child may have passed away, the research still needs to go on. You still need support. We have opportunities to just sit down, talk it out, cry it out, pray with each other, whatever the case may be. And they've been with us every step of the way. So, the more we can do to get them awareness for our specific disorder and rare disorders, we're definitely going to do it.
That's great to hear. I'm so glad this foundation is helping you and your family, and and I'm super excited to hear how it goes on October 5th. Make sure to tell me all about it, and
for sure.
Nashville isn't too far. I live in Georgia, actually. It's not too far. Maybe I could come by.
Road trip. Come on up. I'll buy you a pizza.
What, 3 hours? I'll try. It's on a Saturday too, so I'll definitely check it out. I'll even check out, could you send me, after this interview, could you send me the information for the foundation? And I'd love to check them out as well, maybe get in touch with them, because I'd love getting to learn about foundations out about rare disorders, because the one thing you need, for me to raise awareness, I'm gonna have to be in touch with a lot of foundations, the awareness doesn't happen with just one person. It happens with a large group. So the more the merrier, I guess, that are involved in this blog.
Exactly it.
Yeah. What advice would you give to parents who have kids with the same disorder?
Be patient.
Be very, very, very patient. And by patient, I mean not just with your child. I mean, obviously, they're definitely going to need patience there, but patience with everyone. Doctors, especially, I'm very guilty of getting a little frustrated with ER
No,
doctors.
that's completely justified. I mean, if you have a child with a rare disorder and you're kind of confused, it's justified. Frustration is just a justified feeling.
And be patient with your family. Be patient with your friends. Because even though they want to understand, they really can't. They'll never truly get it.
It's not like they're the ones who have a child with this rare disorder. They'll never know what you're going through unless they happen to have a child. But
Right, and it's like, trust me, you don't want to get it.
Yeah.
You just don't. But, be patient with everyone you know. Take the time that it takes to explain what it is, and be prepared to answer the same questions
Over and over again. Yeah.
But my number one piece of advice is that no matter what the disorder is, no matter what the symptoms are, you are your child's advocate. They can't speak up for themselves. It's up to us to not only bring awareness to our specific set of disorders, or the rare disorder community in general. It's up to us to be advocates with the hospitals, with the doctors, with the pharmaceutical companies. We're the ones who have to stand up and say no or say yes.
Yeah.
And you have to be very, very vocal. You can't be quiet. You can't be meek. You have to stand up, take the bull by the horns, and run with it. And your child's life will be better for it.
That's amazing advice, honestly. I think it'll help like a lot of parents to like not give up on their child. Like if they show that they're not giving up on their child won't give up on them either. And
Exactly.
The advice about being an advocate is amazing, because you want to help yourself, you want to help your child, and you also want to help others, because you're not in this alone. There's other families out there who are going through the same thing. And
Right.
It's wonderful as to like what you guys are doing. It's wonderful as like what the foundation that's helping you guys is do. And it's amazing that you guys have like a group, like a study like group in the university, helping you. You don't hear a lot about that, and you guys are truly blessed to have that. And and I hope your child grows up to have an amazing life. And I mean, I'm sure of it. She has such loving parents who care for her enough to take initiative, to care for her enough to like quit your job to take care of her. And you guys are like amazing parents. So
Thank
yeah,
you so much.
like parents who care and love for their child enough to do all of this, it's amazing. Like you guys are a huge role model to what parents should be. So thank you.
So
Yeah.
much.
Is
We
there
appreciate it.
oh, sorry. Is there anything else you would like to tell me?
Not really. I mean, it's just, know that you're not alone. Granted, your neighbor's probably not gonna have the same experience you do.
Yep.
But now that we have access to a lot more support than we know of.
Yeah.
And if you start looking, start asking, at some point, we'll all connect.
Yeah. And there's some people who are like scared too, but when they see other people coming together, maybe they won't be so scared.
Right.
So it's good that you guys are taking such initiative. I know I said that, but like it's amazing as to what you guys are doing, and I'm so glad I got to talk to you guys today. You guys like inspire me. I mean,
Thank you.
Don't necessarily know anyone personally with a rare disorder. I don't have a rare disorder myself. This is actually something I found like doing a school project, rare disorders.
Oh, really?
And it was something that really like caught my interest, and that's when I started contacting parents. And I was like, they have a story to tell, so I'm gonna tell their story in this blog and raise awareness. So yeah.
And it's people like you that really do give us the opportunity to get our stories out there, so that people do know and understand a little bit more about this.
Yeah.
So you have no idea how invaluable you really are to the entire rare community.
Thank you.
So thank you.
Thank you. Thank you. You guys are too. I mean, look at you, like working. I mean, you working to take initiative for your daughter, and the foundation too. I mean, I know I said this, but it's amazing what you guys are doing. You guys are amazing parents. Just keep what you're doing, and I hope Anna grows up in like a wonderful like environment with wonderful friends, wonderful family, and I really hope she has like the future that you guys are like seeing for her.
Thank you so much.
Yeah. Thank you so much for this interview. you have no idea how much it means to me that you took time out of your day to have this interview. I mean, not a lot of people are willing to do that, and that seeing you guys like wanting to do this in order to take initiative, to take awareness, it just tells me about how great of like parents you guys are. So thank you. So
no worries. Thank you.
Is there anything else you'd like to say before I end? Sorry.
Nope, think we're good.
All right. Whoops, I think I'm done talking. But thank you guys so much. I'm gonna
We're all talked out for the day,
huh? So I'm gonna end the live. Thank you so much. Bye, guys.
Thank you. Bye, guys. Thank you.